Medicine embodies a fundamentally asymmetrical relationship. The doctor knows more than you do and thus has special powers to direct your care. When it comes to the most effective treatments, the expensive ones that could really save your life, the doctor has to order them for you. I cannot walk into a hospital and say, hook me up to an IV. Medicine's professional ethics are supposed to prevent the doctor as businessman from overruling the doctor as professional. And yet the way American healthcare was marketized after World War II made those ethics harder and harder to enforce. Between 1945 and 1965, these dynamics created a set of problems that we still face today. The privatized insurance system incentivized providers to shift more care to the hospital, to the most expensive venue. Both doctors and hospitals charged higher prices, assuming that patients had insurance to cover the cost. Not all of them did. As pharmaceutical companies and medical device makers competed to offer doctors new products and services, planned obsolescence became a byword in medicine as elsewhere in American industry. And while encouraging innovation in high-tech care, the system set up an inflationary spiral in costs. Generalists who spent time talking to their patients saw their incomes plummet relative to specialists who did not. Worries grew that the system promoted overuse of surgery and prescription drugs. Last but not least, significant groups of Americans, the elderly and low-income families in particular, lacked any health insurance at all. By 1960, politicians and journalists alike began to use the word crisis to describe the American healthcare scene. And it was to correct the market failures of this American way of medicine, specifically the care of the elderly and the low income, that the federal government finally got into the business of healthcare in 1965. Alas, to gain support for these programs, Lyndon Baines Johnson agreed to set it up as a taxpayer-funded version of the private healthcare system, with all the same built-in triggers for over-specialization, incentives for more expensive care, and a what the market will bear approach to pricing, worsening the inflationary spiral, again, that we deal with to this day.